We are back with a new episode of Voice of Canada. Your host Asphandiar Wadiwalla, my co-host Cindy Young, and we have a very dynamic guest. He is a dentist and a doctor, Dr. Netan Bobby Bhakri.
Yes.
Welcome to our show.
Thank you.
Please introduce yourself to our viewers. Where you did your dentistry and then your residency with your name.
Sure. First of all, I want to say thank you very much for inviting me. This is a wonderful, popular show, and I'm just very honored to be here. Thank you. Yes, my name is Dr. Netan Bobby Bhakri, and I am in Heartland. The name of my clinic is Heartland Dental Center. I'm in Missisaauga, Ontario.
And tell us from where you did your DDS.
Right. So I did my DDS at the University of Toronto.
Toronto.
Yeah, I did
That's
my
the best
undergrad.
university.
Great university.
Yeah, I worked hard. I was able to graduate with honors from the faculty. So it's a wonderful school. It's excellent.
And you completed your residency at?
At no residency, I actually, once I finished my undergrad, I went into dental school. So I did my undergrad, I did in 3 years. I did my dentistry in 4 years at U of T, and then I went straight into private practice.
Nice.
I skipped over the whole residency part.
Mm-hmm.
Yeah.
And you started your own practice.
So yeah, I associated for about 3 years, and I started Heartland in 2003. So you learn some tricks of the business, the first few years,
That's the main thing. Residency teaches you the art of practicals.
Absolutely. So, but I think maybe I was, honors grad. Maybe I was a little, ready to go.
Aggressive.
I was eager to start. But yeah, and it was wonderful. It
That's
worked out
wonderful.
well.
Go ahead, Cindy.
Good evening, everyone, to our show of Voice of Canada. And I'm Cindy Young, and I am your co-host for this evening's show. And a very special welcome to Dr. Bobby for being with us today.
Thank you.
Dr. Bobby, while reading your bio, we're happy to read the title, the slogan of your dentist clinic is "Life is Beautiful. Let's smile together." What a great slogan. If you can define your slogan, plus what's the title of your dental clinic, which you manage here in Missisaauga?
Okay, so for the second question, it's Heartland Dental Center. That's what it's called in Missisaauga.
Mm-hmm.
And life is beautiful. Let's smile together. If I could just
it's a humor.
Yeah, it's humor, and it's also sort of a deep kind of vision that we've had at the clinic, where people sometimes find life being difficult. They'll look at the screen and what's on the news.
Clinic is giving a hope.
More hope.
To life
And
smile.
I always tell the patients or anybody who wants to listen, if you're feeling like life is not as beautiful as you think, look at the birds, because the birds will actually chirp. Birds only chirp when they are happy. So if they're happy, then you should be happy too.
And that means a healthy smile will make you chirp and
Great. Exactly. So we should smile together with that.
Dr. Bobby, inform our viewers about your childhood, and you are also a Canadian born in Canada.
Correct.
So tell us about your little bit of early life and how was it, and then you became a dentist, and what prompted you to be a dentist?
Yeah, so thank you for asking. So, I was born in Scarborough, and then I was raised in Bramalea initially for 3 years. And that was a lot of my formative years, were over there. I still remember one of my fondest memories when, as a child, was playing on a beautiful sunny day under a blue sky, jumping over hedges and asking myself, it must have been 3 or 4, will this fun last forever? And I think that's what prompted my mind into getting to the root of problems, and which led me to dentistry, which I could explain later. But what happened was from there, from Bramalea, went to North York. I was raised in the Jane Finch corridor.
Wow.
So we learned
That's
a lot.
Risky Hearing Jane, we feel risky.
Yes. It was, and it was, and it also, there was also a lot of love there. And humanity has a persistence about itself.
For sure.
And so I learned a lot. I learned a lot how to read people unknowingly. I learned, how to engage in a room. And it was great learning for me over there.
Amazing.
And from there we moved to Thornhill. And
that's a good area.
It was a completely different vibe there.
Yeah, for
And
sure.
then and onwards, and then by education, was when.
And you're destined to settle in
So
Mississauga.
destined to
Yeah,
settle in
good
Mississauga,
job.
yeah, and that's and eventually, yes, I was here, and it's a best move that we made.
Oh, very nice.
Yeah.
Dr. Bobby, from your bio, we learned that you passed your early days in North York, which you did say as well, in a big family of dozens of people.
Yes.
Can you tell us a little bit about your happy memories that you spent together?
The whole family about.
Yeah, lots of families.
Yeah, just real quickly. This formed me a lot. I was raised in a family with 12 people.
Wow,
were in a
that's a lot.
Yeah.
Those all
Canada
siblings?
Yes.
Stranded.
Yeah. Okay. So these are not the siblings. I have a brother and a sister, and my mom and dad, and then there was some aunts and
Right.
uncles, grandparents.
Yes.
And
Extended family.
yes, extended
Nice.
family. We were in an 1,100 square foot home, so it was
Cozy.
cozy, very cozy.
Cozy, yes.
And but I learned the language. I learned Punjabi. I learned Hindi. I learned
Beautiful.
so it was good. You learned the culture a little bit, and so happily, it was a very fun life. We had beautiful times together.
That's amazing.
Yeah,
Oh,
and
very
it
nice.
really helped me understand, how to engage different levels.
For sure.
The elders to the youngest.
Absolutely.
And from there, everybody gets married and it gets bigger and bigger. So the family is extended. So if you go to the East End right now and you say the name Bhakri, you'll bump into somebody in the family.
Yeah. Bigger family now.
Yeah.
Dr. Bobby, you're the owner operator of Heartland Dental Center. Am I right?
Correct.
You repeated twice,
Correct.
informed about
Correct.
viewers. So just tell us, your dental center provide what kind of treatments in dentistry?
Okay. So we do all.
That is a little detailed reply I would appreciate.
Yes, absolutely. So we do basically everything. We have oral surgery, which is extractions. There's the cleanings. There is root canals. There is sleep apnea. There is whitening.
Uh-huh.
There are prosthodontic, cosmetic stuff as well. We've also just started sedation dentistry, IV sedation. So in that way, you can consciously knock somebody out, and it's safe because you're still conscious,
Right.
as opposed to general anesthesia.
Means the local, you mean?
No, actually,
No.
this is the so local is just when you're awake and we
Uh-huh.
numb you, but IV sedation is when we through the IV,
Oh my
we will put you into a conscious sedation. So that means you're like in a deep sleep,
You're watching.
but you're still aware.
Aware.
But we could tell you, but you'll be sleeping. But we could tell you, open, turn this way, and you will respond, but you won't feel any
I've
pain.
never even heard
Yeah.
of that.
Heard of
So,
that.
yeah,
We
so-
used to take injections and go for
That's
the
it.
local.
Yeah. So this is
Wow.
IV sedation, and then the one that's deeper than that is general anesthesia, which we don't want to provide because
Unless you have
at
to.
the clinic, because that requires even further specialization,
Sure.
and
Yeah,
there's
yeah,
some
yeah,
risks, more
anesthesia.
risks.
More risks involved.
Yeah, it's it's just we were more comfortable keeping it at the level of IV sedation.
Yeah.
Yes.
And you all follow all the surgical procedures? Also?
Correct. All you don't eat 8 hours before you come.
Mhm.
Have somebody with you at the time. We won't release you until we are confident that you're okay to leave.
And you feel nothing with the IV?
Nothing.
Wow.
You won't know. You won't even remember. You'll just come out and you'll be a big smile on your face.
I've never even heard of that. Wow.
We learned something
Oh,
new.
awesome.
Yeah.
That's good.
Fantastic.
Great. That's fantastic.
Dr. Bobby, you opened your Heartland Dental Clinic in 2003. Your dental center is 22 years old now, so it must have plenty of regular patients by now. If you can give us just some views about your business.
Yeah, we're busy. It's really nice. The community when we started really embraced
It's
us.
very heart of the city.
Yeah.
Yeah, and Heartland's
Yeah.
a great
Business center,
location.
residential
Yeah,
nearby.
absolutely.
Yeah.
There's all variations
Everything's
of
there.
people.
Yes.
They've really, they've engaged. We're trying to be as community focused as
You
possible.
found a good location.
Yeah,
Amazing
exactly.
location, yeah.
And it's been consistent. It's been we've been constantly expanding. We started with one room.
Wow.
We're now to 5, planning on our
Amazing.
6th one
Amazing.
to open.
Wow.
And it's funny, when I first opened this office, everybody was telling me this office is too big. Like, why you're in an established area, it's too big.
Uh-huh.
And now I'm finding myself wanting
Too
more
small.
room.
Space.
I want more
Too
room.
small,
So,
yes.
Inform us also that how many associates work at your clinic.
Yeah, so currently we have 3 associates working, plus we have a medical anesthesiologist. So he's a medical doctor.
So
And
he's
that actually
available
was-
every day or only the day of the surgery?
Correct. He's like once a month he'll come,
Once a
and
month.
and that's when we do the surgeries.
Right. Right.
It's a challenge to
Get
keep
them
a
all in
medical
one day.
doctor in house every day.
Definitely.
Yeah,
Yeah.
but we're blessed to have him come
Once a month.
once a
When,
month.
as and when necessary. with the
Correct.
patient's
Yeah.
requirements.
Correct.
Yes. That's you. Shut up.
Okay, Dr. Bobby, after opening your clinic in 2003,
Yes.
you were quite successful. That you started planning to open up a second dentistry, which is on Trelaway Circle near my place where I reside, and it's a beautiful residential area. And since the time, that is also nearly 20 years old, and fortunately run by your own spouse.
Yes. Yes.
We were very happy and to note from your bio that when you were planning to open and all, you also met Dr.
Yes.
Dr.
Dr.
Sonia
Sonia
Kapoor.
Kapoor. Yeah.
And now you both husband and wife, and you are having
Yeah.
a family together.
Yes.
So give us your incident,
Sure.
your happy incident.
Absolutely. So I was expecting you to say it's such a beautiful area with such a beautiful doctor over there too.
Yes.
Yeah. And now you've seen the beauty, and now you can see the beast too, right? So yeah.
No,
here's
no,
the
no.
other. But
I'm with your clinic for over 5-6 years.
yes,
Yeah.
I was planning on finding an associate, and I ended up hiring my boss.
Boss.
That's actually what
Oh.
happened. She is the
Now
boss.
she is the
she's
boss.
right? So, so
you go.
yeah, no, it was opening up the second clinic. My father told me you better work on this, and find somebody who can manage this and run this. And I happened upon her resume, and here I see
She applied.
she applied.
Oh,
Harvard
wow.
graduate. McGill graduate.
Yeah,
Yeah.
that is impressive.
Oh, very
Yeah,
impressive.
very impressive
Very
bio.
impressive.
I get impressed. I'm very
Yeah.
happy to see this
Yes.
two certificates.
Absolutely. I
Yes.
tell everybody I meet these days, I say, hey, she went to Harvard. She's very humble.
Yes.
But I make sure everybody knows she goes
Yeah.
there. Anyhow, I met her. And I should say another way, I looked at her resume, called her. When I don't know if you're familiar with Hollywood or Bollywood movies,
Mhm.
but when I saw her, I literally saw my whole life
Whole life.
Wow.
in that
This is a
moment.
instant liking.
Instant. And I saw my
It was an
children. I saw
instant,
everything.
instant
Yeah.
connection.
That really happens.
And then naturally, you have to develop that relation.
Yes,
And
of course.
thankfully, she
But she
accepted.
did not work at your clinic.
She actually did. She worked.
2003.
She worked for. She came in 2005, and she
Fine.
worked for about
Sometime,
a year. About a
your
year
place.
at my place. Yeah.
And then this was independently
Yes,
opened
and then she ran this since.
and became the
Right.
boss.
Yes, and became the boss.
Yeah.
Both.
Both.
Yeah.
And she's
All
the
round
leader
boss.
now.
Yes, I just listen to the big boss. She tells me where to go, what to
He's
do.
a sensible guy.
Yeah.
He listens
Absolutely.
to his spouse.
That's the way it should be.
That is
Yeah.
a rule in Canada.
Yes,
If
I'm
you
a-
listen to your spouse,
That's right.
you are the happiest man in life.
Yeah.
Absolutely happy. Yeah, 100%. Yeah.
Dr. Bobby, what types of services? You did tell us a little bit about the services, but maybe you can expand on them.
Sure,
of
sure.
The types of services that you offer.
So the number one position that I like to take is, again, like I was telling you about when I was a child, and I was always wondering about the roots of things. So I'm very, very much into preventive
Preventive.
dentistry.
Mm.
You know, what you've been given is number one. What nature gave you was number one. What any human will give you is number two. So I often ask the patients, if we were both intelligent, we should be supporting number one. You should be asking me what to do, and I should be guiding you.
Guiding you.
And if you need number two, we'll give you the best number two. But why do you want number two? So this is sort of the crux or the root of our intentions at Heartland is to get to the root of the problem and keep what you got.
Mhm.
Try not to do too
And
much.
Right.
Overdo anything.
Overdo
Right.
anything.
But do
yeah.
what you have well.
Yeah.
We'll
Exactly.
be taking a short break and be with you soon. Welcome back after a short break in our weekly talk show, Voice of Canada. In our community service episode number 2, we have Dr. Bobby Bhakri,
Yes.
a
Thank you.
well-known dentist from heart of Missisaauga. Dr. Bhakri, inform us and our viewers that you proclaim that in your bio, no dentistry. So what do you mean by no dentistry? Dentistry is a must for every human being.
Yes, yes. I have to qualify that. And I tell that new patients come in, it's always a good laugh. I said, I asked them, do you know what my favorite dentistry is? And they start asking me, is it root canals? I said, no. Is it fillings? I said, no. And I said, no, my favorite dentistry is
There's
no dentistry.
dentistry.
What
I
can we
get
go
it.
against
Well,
you?
yeah, go against this
Dentistry,
and this
what
guy.
do you say?
Yeah, what is he talking about? And then I said, let me qualify. No dentistry means preventive dentistry. Come for your
Preventative.
checkups.
Right.
Come for
So
your
you don't have to do all
cleanings.
those big things.
Yeah,
Proper full year.
yeah. Because, like I
Yes.
said before, what you have, what you want to support, and supporting teeth is not just brushing and flossing. It's the quality of your blood. How is your
Everything.
calcium? How's your vitamin D? How's your
Yes.
B12?
And
Yes.
How's your
mental
iron?
intake and all that, everything is connects to the.
Yes, to the whole
Everything.
body.
Yes.
So, are you doing that? How's your breathing? Are you clenching? These are all connected. You get to the root cause of what the
Absolutely.
issues are. You don't need any dentistry in the sense of the dentistry that we try to understand what dentistry, which is fillings, extractions, root canals. You don't need that if you get to the root cause of it.
Absolutely.
And that's where I come back, and it's my favorite motto, and get a good laugh from all the patients.
Actually, I love that.
That's
Yeah.
a good thing.
Yeah, I love that.
Humor, you inform the patient
Yes.
to be alert
Yes.
and have a good maintenance
Yeah.
of your
The
teeth.
maintenance of it's really important.
Absolutely.
Go ahead.
Yeah,
Absolutely.
absolutely. So now on a lighter note, Dr. Bobby, let's briefly discuss your immediate family, maybe some of your offsprings as well.
Yes.
Are your children also planning to become dentists and manage
And
your
all the
existing
three are
dental
going to be a
clinics?
dentist.
Yeah,
only one.
well,
Let's
so the eldest
see.
one seems to be
I
showing.
asked him.
Yeah.
I've got
You
a
did
witness.
ask him that, didn't he?
I asked him.
You did, and I was very shocked. He was very resolute. He said yes.
Oh,
And,
so
He said yes.
yeah.
how old is he now?
He's 15.
Oh, yeah,
so-
so,
So
my-
proudly told me,
Yeah.
yes, uncle,
Yes,
I will be a dentist.
I will.
He probably
yes,
will
yeah.
be. He probably will
I,
be.
I have an elder son, and
Yeah.
then my middle child is a daughter. She's 11, and then I have
Nice.
a younger son who's 9.
But they must be hearing all about the
Yes.
dental clinics and dentistry and all from both husband
Yeah.
and wife.
Yes.
So
That's kind of what they live
definitely
with.
there are
And
things-
they've come, and we've tried to say, how many fathers can come pick up their children at school? And I say it's all thanks to dentistry that I
Yes.
could come and pick
Yes.
That's
pick
what I
you
told
up.
Sonia also.
Yeah, it's
Yeah.
dentistry gives us the flexibility and time.
Flexibility,
For
time
sure.
for the family,
For
for
the-
the children,
Absolutely.
upbringing and everything.
100%. So
Yeah.
the children are seeing that, and they're this generation is fairly smart, and they want balance too in their life,
They do.
and they're looking for ways to do that. And dentistry gives that means to it. So all three of them seem to be showing interest right now. Now, what happens
But
later,
anyhow,
we
the
shall
first
see.
had already committed that he's going to be a dentist.
Yes.
Yes.
And he's going to employ both his parents.
Yes.
He's going to be the boss
That
now.
also
Yes.
confirmed. He
Yeah,
showed me
he's-
the
That's
red
right.
flag
Yeah,
also.
yeah,
He
yeah,
said,
yeah.
"Uncle, the day I take over, both will be my employees.
Well,
That's right. You're gonna be working
he
for
will
me.
do that. Yeah, he's already saying, "Dad, you should be doing this. Dad, you should be doing that." No, he's lovely. He's very good.
That's
the family,
cute.
the family it's good, and it's dentistry does allow for that. So,
Absolutely.
and I think we're showing the good side of it. And like anything, any job, there's challenges. When you're a dentist, most of us dentists are trained clinically.
Clinically.
And when you get
Yeah.
into the real world, you not only have to wear your clinical hat, but you have to wear your managerial hat, which most of us are not,
Management,
Absolutely.
administration,
as
of course.
well as the entrepreneurial hat.
Yes.
And all three of those hats, mostly we're just trained in one and not the other two. Those are full-time jobs in themselves.
Absolutely.
So this is a very
But
unique
still, you're a
position.
light-hearted man, what I saw.
Yeah.
Sonia is very stern.
Yes.
You won't believe during the time I was contacting her,
Yeah.
the lady used to shiver.
Yeah.
Contact Sonia, please give my name and contact her. She used to think again,
Yeah. Again.
if I disturb her at the house, she
That
has
is
to
awesome.
hear.
Yeah.
Then I told Sonia, I
Yeah.
laughed at her. I said,
Yeah.
hey, Papa, don't keep us so tight.
Yeah.
They are afraid to even call you and
Tell
tell you.
you,
if it's
yeah.
emergency also, they are not afraid to call you.
Yes. And and it's a fine line
It was
between.
for her.
Yeah.
And I'm
Yeah.
telling her, it's good for Dr. Sonia what I'm asking. You just
Yes.
connect me.
Yes.
I can't
yes.
connect with her.
Yes, absolutely. No, and you make a good point even at a general level that, it's very hard, the fine line between being professional and being yourself.
For sure.
Sometimes
That's
it's
true, and they are a good staff.
and-
Even
oh,
I see
yes.
it,
Yes.
I've seen them
Yeah.
in 5 years. They're thorough professionals.
yeah, and on that end too, just speaking at Heartland, it's my team is, they've been with me for a long, long time, and they've been excellent. I always thank them that the life
We'll
I'm
visit
leading.
soon. One day we'll
Yeah.
make a plan
It's thanks
to
to them.
visit your
Yeah.
clinic.
Yeah, thank you. Yeah, wonderful. We'll
We'll
love to
inform you in
grace you.
advance.
Oh no, please come anytime. The doors are open.
Go ahead.
Dr. Bobby, if you can inform our viewers how many types of infections happen frequently and what are its causes, how is it transmitted, And what actions do you take for it?
Wonderful. So, let's. This is an excellent question. I'm going to really simplify. It's a little more complicated, but we're going to make it very simple. So, cavities. Cavities that we all know. What are they? They're infections of the teeth. They spread. They're actual infections that will spread. So if you get on one side, they will go to the other. So that's number one. So infections
They travel from one teeth
to
the
another.
teeth.
100%.
Cavities,
Yeah,
really?
they are. They spread.
Wow.
And this is why, although this is a family show, but kissing transfers a lot of
That was
bacteria.
just something
Bacteria.
It is a surprise.
surprising when I read in your bio, you said kissing, lots of people are going to go against you.
Yeah.
You are restricting them from kissing.
No,
And that's
I
also
said
French kissing. It says no
Yeah,
French
No, I said, well, I was qualifying. I said, no, kissing is good.
But how
But
can a man and woman
yeah,
survive
no,
without kissing?
yeah, you have to kiss. But I said,
This
make
is
sure
Canada.
make sure you see your dentist first and get it cleared. Make sure there's no infections. And
Infection
then
or
go
not.
ahead.
Go
And
with
yeah,
your partner.
Because and also from mother to child, it gets transferred that way
Yes.
too. So let's coming back with types of infections. Number one, infection in the teeth
Gum.
is cavities. Infections in the gum is gingivitis.
Oh my God.
Yes.
Infections in the bone that support the teeth is periodontitis.
Wow.
And now we
Okay.
got to say one more step. Unfortunately, you hear these stories about people getting heart attacks
Yes.
suddenly and nobody knows what it is, or they have a stroke and nobody knows what it is. I suggest to people that think the mouth is 3 inches from the brain and 6 inches,
From-
12 inches from the heart. Okay,
Yes.
12 inches and 3 inches from the brain. So the next time somebody has a heart attack or stroke, one should ask them, when was the last time you
They
went to the
a
dentist? What was there any infection and was it treated?
Wow.
So that's how
Yeah.
serious it is.
Yeah.
Yeah, so
But
it's a missing
people are
link.
well
It's the
aware
missing
now.
link.
In Canada, the people are very conscious.
They are.
They have
It's
regular. They get
it's
regular.
starting, but
Yeah.
we, as in the dental profession, we are working harder to get this education out. It is still. I think we got to keep moving on this and keep pushing
Yes.
this. It's
Yeah.
getting better, but the mouth is
Very
absolutely
important.
the missing link between almost every disease.
Everything.
And the beauty how nature is created is you can't open your chest and look at your heart. You can't open your stomach and look at your
Right.
stomach, but you can open your mouth and look
And
at
look at
that.
your-
If you know
yes.
what to look for,
Right.
you're going to solve a lot of problems.
See, it's a good
Yes.
information you gave us and our viewers. What I was presuming that cavity is due to with the age, the cavity increases.
You know, and
Well, I
these
was
are
just thinking
specific
like it's
terms,
just like eating away at your tooth,
Mm.
not so much that it's an infection
right.
And
I didn't know that it was an
and
infection.
so it's the best
or that
way.
it spreads.
Yeah, no, I know it's the
Wow.
most basic things, and we have to come back to that. And remember, our mouths are full of all sorts of bacteria, good and bad.
Yes.
When you eat foods that create acidity in your mouth,
Yeah.
the acidity selects the bad guys, who then go about eating away at your teeth, and then it just spreads from one place to another because the environment suits them.
Right.
And our
Yeah.
diet
Makes
is
sense.
lots of sweets we consume.
Yeah,
Yeah.
Canadians, children, chocolates, ice creams.
absolutely.
But even a lot of your fruit
Yeah,
that
fruit.
you eat a lot.
And again, even milk. So children, babies,
Really?
babies get
Milk.
cavities because
Yes.
you have to wipe the teeth of the
Uh-huh.
child because they will drink milk. Milk has a sugar,
Sugar
in it,
and
right?
calcium.
The lactate, in that.
Yes.
And that sugar, if you don't wipe it up, it's going to create what's called baby bottle cavities. And a
Wow.
lot of parents are disheartened because they didn't know this. They said milk makes teeth strong, but it does. But you have to wipe it because when
But
it
not
sits
when
in
it's
the mouth,
sitting on it.
yeah, exactly.
Right.
So it's this is the root of all suffering is ignorance. Really.
Yes, no,
and and what can somebody do if they weren't taught this?
Right.
So they're not even ignorant. They're neshit. Neshit means you don't know what you don't know.
Don't know.
So
Yes.
if somebody doesn't
Sometimes
teach
in
you,
McDonald's, things happening really
Sometimes it-
gives a big prize. You have to
yeah,
pay.
yeah, and exactly. And then there's a
Yeah.
lot of pain and suffering that comes after
oh
that.
yeah, especially in
And
the mouth.
Yeah, and especially if you
Yeah.
have children and you have to go through that, then you have to
Mm.
sedate the child. You want to create a good experience for the child in the
For
beginning,
sure.
and then if
Prevent
you,
it from happening in the first place.
exactly.
Yeah.
So coming back to
Dr.
that
Bobby,
prevention.
as we are discussing about the hygiene of the mouth, would you inform our viewers how many dental hygiene visits an average age-wise group a person should have in a year?
Okay.
Mm.
So mostly it's defined based on how well you're doing. So if your bones are healthy, your gums are healthy, once every 6 months, and pretty much all age groups is a go-to a good recommendation.
For hygiene cleaning.
For hygiene cleaning, yes. For scaling, what they call scaling
Scaling
and
also,
root
yeah,
cleaning.
scale
Your
and
hygienist,
remove, yeah.
Whatever.
And what are we scaling exactly? That's a great question. Scaling is removing the toxins, not only the bacteria, what we call tartar.
Tea, coffee,
Tartar.
toxins.
Yeah, that's a stain. But tartar is actually
By food.
it's by the bacteria that eat
Oh my
at the enamel and take the calcium and create their own hardening. So they harden.
They do.
And then I'll say they have to scrape it off. But I often ask, but where do you think this calcium is coming from? It's coming mostly from your teeth. It comes from your saliva and it comes from your teeth.
Right.
So and all of a sudden now, because these bacteria, they don't want to disappear. They want to build a nice home for themselves. So they have a nice
They
thatched
settle
roof.
down on your
They
teeth.
settle on your teeth and then they
Yes.
create a home, which is the tartar. So tartar is actually, tartar and plaque is infection. It's
So-
the byproducts that we're removing.
So can you inform us and the viewers how many
Wow.
times a person or children should brush their teeth?
Oh, very good. Brushing your teeth generally twice a day is good.
Morning and night.
Morning and night.
Morning and night. Yeah.
Why is it more important if people say, if I have to do it once, when should I do it? I'm like, well, you should do it twice.
Twice.
Really,
It's the right way.
you should do it every time you eat. You should brush
Yeah,
after.
but yeah.
Okay,
That
but
never happens.
realistically, it doesn't happen.
Never
Because
happens.
So-
many do 3 times also. After the afternoon lunch also they will brush and then
I love them too. And they're wonderful. And you can see the difference when they do that. And again, brushing of two sorts. You can't be aggressive. It has to be a feather touch. It has to be
Yes.
vertical. And it's most important at nighttime. Why? Because at nighttime, your saliva, your spit, which has the antibodies in them that protect your teeth, it reduces at night.
Reduces
So you
your
want to remove
dryness.
as much, you want to remove as much bacteria at that time, particularly, because then you're actually getting in front of any infections that could be happening to you. Yeah,
Mm.
Oh,
wonderful.
okay.
That's a very good. And brushing technique, and the number one reason
Yeah.
for recession in the
Reset-
mouth
recession
is
of the
aggressive
gums.
brushing. Is aggressive brushing.
Mhm.
And my question is again with the same answer what you are giving. Yeah, we have got mouthwash. So how can we inform us the use of mouthwash?
Yes. So mouthwash, there is a various sort. Now, I'm not going to use any names, but the most
No
common,
names, no brands.
yeah, no
I
brand.
wanted the usage
Yeah.
of mouthwash.
Okay, fluoride rinses that are available are very good because they help to
The
remineralize.
non-alcoholic ones.
Yeah, non-alcoholic ones are the way to go. Why? Because the alcoholic ones will dry your mouth. And already, like I
Mm.
said, your saliva is where your antibodies are. So
Right.
you don't want to dry that out. You want to keep that going. So fluoride rinses are wonderful if you have issues with.
So you mean after
decay-
every brushing of your teeth,
Mm.
after that final is the mouthwash.
Yeah, but
Gargle with mouthwash.
you don't. It's not
Mm.
mandatory.
But
It's
if you
what-
do, it's
yeah,
good for you.
Yeah, it's
for
an
the health.
adjunctive. Adjunctive means we can add it to it, and it will help. But best still is brushing and flossing.
Yeah.
Fluoride rinsing is good. All the other rinses it depends. If you have gum issues, there's some special gum rinses that we can
Right.
prescribe for you. But all the other over-the-counter stuff is just maybe if you feel happy breath freshening or something. That's
good,
about
Yeah.
it.
good products are
Yeah.
available currently, non-alcoholic,
Mhm.
and they really freshens your breath.
Yes.
Plus kills all the germs
Yes.
which are in your mouth.
Yes. Yes. Yeah.
So, and another thing, it's a continuation of my question only. What would you recommend in English, electric brush or a hand brush?
Yes. So that's an excellent question. So
Yeah.
studies show that electric brushes clean better
Better.
than a manual brush.
Manual brush.
But here's the catch, because there's always a but and a catch.
Mhm.
The catch is that the manual brush, the rotary brush must not be used like a manual brush.
Mhm.
Most people brush like
Yeah.
this,
Harder
and
brush.
they
Yeah,
damage
they-
their enamel. They
Yes.
damage their
Cement their
gums.
gums, yeah.
Yeah, so
Yes.
when you do a rotary brush, you must walk it. So you lift it. You start on one tooth, you lift. Go to the next,
And the
you lift.
duration should be 2.5 minutes only.
Correct.
Let's see.
Hey,
Talk,
somebody's
people
been
should-
teaching
Yeah.
you. I'm gonna comment, give commentary
we
to
had
Dr.
an
Kapoor.
interview
Just
of
pressing
another
too
guy.
hard, yeah.
She gave us a very good
Okay.
lecture.
I
about
know
it.
she did.
Okay.
Yes.
All right. Good.
That's why we are so well aware.
Wow. I'm
I've
impressed.
eased up on my electric toothbrush.
Yeah. Good.
Go ahead. Signals are right.
Dr. Bobby, if you
Yes.
can inform our viewers, does your dental clinics accept all health insurance
Yes.
and offer treatments? Plus, the Canadian government introduced the dental health policy.
Government dental policy.
Yeah, it's for income groups. If you can tell us a little bit about that too in
Sure.
dental plans.
Yeah, no, it's we do accept all insurances.
All insurances,
Yeah,
private
as a
insurances,
pri-
company insurances.
That is
plus
correct.
the government dental also.
Plus also the CDCP, which is the government plan, and the government plan is good. I think there was a lot of the dentists, or I shouldn't say a lot, but there were enough that were concerned about it. Government issued programs. There's always a question mark. How well they're run and are they even effective? This one seems to be pretty good. So far, so good. Of course, it's not all completion. No insurance can cover everything.
No, that's right.
They're not designed that way.
But you can't have both. Now, if you have got a private insurance, then the government won't give you.
Correct.
Right,
Yeah.
right.
You have to follow under a certain income
Income
level.
bracket.
Income level
Income-
and the age level, and
And
it's for
yeah.
retired people.
Correct.
Yes.
And we've been seeing a lot of influx, and it's what I like about this is that this program has opened up the non-patient pool, meaning these people were never patients before, and now they actually have come to the dentist after. They weren't even patients for anybody. For
They wouldn't
25
even
years.
go.
Yeah, they've
won't
never
even
gone.
go.
So it's suddenly
Yeah.
opened
A new
an opportunity to teach and guide and bring up the health of a population that needs
And
it.
the doctors must be working really hard with this patient who have not been to dentist
Correct.
regularly.
Right.
Correct.
So that the government meets the expenses of all the treatments you'll provide them.
Yeah, it's the government is doing pretty good with this one. I would say for the vast
lenient.
majority. Yeah, they've improved on the issues that the dentists were having. They've done quite a improvement. There's some more improvements that need to be done, but generally speaking, it's been excellent. Like in the sense that it's a lot smoother than we had thought. And I'm pleased that again, non-patient pool, people who have never been patients,
Right.
are actually coming. So it gives us access to that group.
Right. Jump on 16.
So, Dr. Bobby, if you can inform our viewers of the issues related to dental clenching.
Yes.
Grinding, snoring can be treated. Can some of those things? So maybe you can tell us a little bit about that too.
Yeah. So mostly clenching, grinding, and snoring is a major issue in dentistry, because what's happening is damaging, it's cracking, it's wearing, it's tearing the teeth. Understand something too, at a much deeper level, which nobody I'm sure has mentioned this to you. Your vertebrae in the back have 3 points of contact, just like you can make a chair that has 3 legs, so it's stable. So each is a 3-point contact, so it's stable until you reach the last vertebrae, which is called the atlas. And the atlas only has 2 points of contact with the head. So where's the third point? The third point is the height of the teeth. So the height of the teeth support the head on the neck. When you grind and wear your teeth, your head starts to collapse on the neck. And there's major nerves that control heart rate, respiratory, and digestion.
So
if that crimps here, all of a sudden you get heart palpitations or something else, you're not going to go to your dentist. You're not going to think about a night guard.
For the paucity of time on 18.
Wow.
Yeah.
Jump on 18.
So time has definitely flown by, and thank you so much for discussing all of the healthy teeth and freshness of your mouth, all of those things. Would you like to give some of your final remarks and comments to our viewers?
Patients and people who want to improve their health, the dental health, some advice.
So the main thing that I'd like to tell everybody is there used to be a fun little line I used to say that if your gums bleed, you need a dentist indeed. And basically that little lingo means that bleeding gums is one of the key indicators of poor health.
You need a dental health.
That you need, you need a dental assistance, and it's showing you that there's potentially issues that could be happening with your heart. We got to look at all those things. All right, it's much deeper than I could just say in a short span of time, but keep that in your mind. If your gums bleed, you need a dentist indeed.
With that final remark from our guest, Dr. Netan Bobby Bhakri, we thank him for taking out time for us from his hectic schedule.
Thank you very much.
Evening time is usually a busy time at the clinics, but you came and that definitely benefit you, because lots of our community and Canadians watch our show, and we are quite known weekly talk show. So wish you all the best, and future also, if there's any breaking news or anything you all want to inform us, just give us a call.
Thank you.
And we'll make it short. We can even bring that in our news section.
Oh, wonderful.
We have a news section also.
Is that right?
So we can do that also. So with that note, we'll be signing off from the episode of this week with Dr. Bhakri. Next week, we'll have the new guest in Voice of Canada. Keep watching our show every Saturday at 8 p.m. And we would like to say good night, goodbye. God bless Canada. God save our King.
Yes.
Good night, everyone.
Thank you. Good night. Thank you.